The Senate is calling for more funding for the health sector, especially at the primary healthcare level where non-emergency preventative health issues could be managed. The Senate, through its Committee on Health, chaired by Senator Ibrahim Oloriegbe, lamented on the paucity of funds being budgeted for healthcare services on Tuesday in Abuja, calling on the federal government to accede to the needs of the ailing sector. Senate correspondent files in this report. Stakeholders in the Nigerian healthcare system believe the sector has suffered several backdrops, especially at the local government level, such that monitoring and preventing the outbreak of communicable diseases can be an uphill task. During the report on the state of healthcare service delivery in Nigeria, Chairman Senate Committee on Health urged the federal government to consider the sector during its budget.
And many Nigerians, that means they still have a lot of problems accessing healthcare. Without mentioning states, Zamfara State, maybe based on its alphabetical position, seems to rank the poorest based on this report. But I think it is not about where you are now, it's about what effort you want to make. I think what should be important with this document for us is for it to be a kind of check on the responsible person in each state to do more.
The lawmaker further stated that funds meant for the sector are usually being returned to the coffers of the federal government, which he decried.
It's very sad to say that even the budget, the normal budget allocated to health, the health sector does not consume its money. Can you imagine this all, that the health sector return money back for non-spending? It happens in this 2022. In 2021, it almost happened. It didn't happen because they just warehouse it. But what will it be spent for?
During further review, stakeholders say only about 20% of public healthcare facilities across Nigeria are fully functional, while others cannot provide essential healthcare services for majority of people based on need without financial barriers.
We are telling the government and the stakeholders that citizens are watching. It is not just about we campaign, the money is now available, but we don't get services. So today, what you're going to be seeing today is an evidence to show that we are still mobilizing citizens to watch that sector.
We've also looked at budgetary commitments at state level, which would ultimately, again, be the key driver of funding for the health system at the state level. As much as the Basic Healthcare Provision Fund rose from the federal government all the way through to states as is needed, we also recognize that the state level budgetary commitments to health in itself are critical.
The report aims at stimulating interest from critical stakeholders to improve the overall primary healthcare delivery in Nigeria. From the nation's capital at Sinukenuke.